Today on Let's Talk, we have Weldon Johnson, and he is the Executive Director of the Delta Dental Foundation.
That's correct.
And Weldon, tell us a little bit about why you're in Jonesboro.
We have a program that we're trying to go statewide with to help young children in schools to help reduce dental disease, or dental caries, or as we would call it, cavities. That's the most chronic childhood disease in America. Our third graders in Arkansas, about 64% of them have either had it or have it currently right now. So the best way for us to attack this problem is to enlist school nurses across the state. Today, the school nurses for Northeast Arkansas are meeting here in Jonesboro. So there was a dental hygienist from the Office of Oral Health in Little Rock that made a presentation to them on the importance of dental health and how the nurses can help with it, and then went into the clinical portion of the things to look for. In 2011, the legislature passed a law that enabled licensed healthcare professionals, after taking a course and passing a test, could be certified in doing oil screenings, fluoride varnish, risk assessments, and oral hygiene instruction for kids. So far, we've got about 20 schools in Arkansas that have been participating on a pilot program. The biggest school that's doing the most right now is in Little Rock School District. And they're getting ready to start, I think, the third year of this program. But what we're trying to do here in Northeast Arkansas is get schools to do a mini grant. They're up to $2,500 and can easily fund a program for pre-K, kindergarten, and elementary school kids.
That's great. Now, what do you encourage? What do you know about Jonesboro? I know you had upward of 75 to 100 school nurses in the Cooper Alumni Center today.
That's correct. And I'm not as knowledgeable about Jonesboro as I ought to be, but you know, the mayor and I have been friends for about 20 years now, and I believe in what he's doing. He's a big proponent of oral health, and so we're welcome to Jonesboro to come in. We also, you know, a year ago did the Mission of Mercy here in Jonesboro and had great results.
The Mission of Mercy is one of the coolest things that happens in Jonesboro, because we watched the entire Convocation Center floor turned into one big dental emporium of some sort, where I think 4,000 to 5,000 people had dental work in 2 days.
It wasn't quite that much. I still have the article from the newspaper
Do you?
laying on my desk, and it's laminated. And I think it was 2,333
My goodness.
people. Now, some of them had multiple things done.
Right.
So I think they did a little over $2 million. Is that right? No, maybe it's $1,300,000 worth of dental work that day.
Right.
And I think it was the most successful Mission of Mercy in the United States last year.
Yes, I think so. And it was just fabulous to see everyone. You didn't ask them, you know, where they came from. You didn't ask them for an ID. Just show up and get your teeth fixed. So.
That's exactly right. And getting your teeth fixed makes a difference in your life. And there's so many connections between dental disease and heart problems and diabetes and some pulmonary complications. Dentists, I wouldn't be surprised if dentists don't find more oral cancers than medical doctors do, because they look in the mouth all the time and they're trained to do that. So there's lots of other things that they can find in the mouth. And of course, the mouth's the gateway to the body. So that's another one of our initiatives, is to try to get the medical side of healthcare and the dental side to coordinate their efforts together.
So what was your message to these school nurses today?
Send me a grant application and let me help you start this program and see how easy it is to do and what a difference it'll make.
And tell us what exactly what it entails.
Like I say, first the ladies had, most of them were ladies. I think I was the only man in the room today. And there was some brain power and some intensity. But the first part was to listen to the hygienist and see if the 45-minute presentation that she had. Then they'll go online and take a course that's on the Department of Health's website. It's a nationally standardized course called Smiles for Life. And so it's, like I say, to do oil screenings, fluoride varnish, a risk assessment, and then oral health instruction about hygiene, how to take care of your teeth, how to eat properly.
That's some of the things that I think young parents sometimes struggle with, exactly how to help their children maintain their teeth.
That's right, and what's amazing to me, until I started studying it, it was kind of an eye-opener, is even well-educated people that you would think would know better, don't know all the ins and outs of how to really take care of your teeth and your mouth. There's a lady that we work with from Indiana that is a specialist in that, and she's done a research to show that folks even with PhDs have very low literacy for medical and healthcare unless they're in one of those professions.
Right.
So that was kind of a surprise to me.
That makes good sense, but you don't see many dentists with bad teeth.
No, you don't see many hygienists with bad teeth either. But the problem is, if you only got 1,300 dentists in the state and 1,500 hygienists, how do you take care of 3 million people?
That's not enough.
And using the nurses and the medical doctors, nurse practitioners, that if we can get more of these to take this course, there's 52,000 nurses. Look how many more young kids especially that we can see and take care of and at least do the preventative measures. And where a preventative measure may cost $5 or $10, if anybody's gone to the dentist and had a filling done or a crown done, they know how much money that cost.
Yes, it's sometimes it's prohibitive, and our insurances, I hope, are stepping up to do their part. But you guys have several programs that help people. And not just the RMOM, which is treatment for something that's already gone wrong, but you have preventative concepts, and one that we've seen lately is called Rethink Your Drink.
Yes.
Can you tell us about that?
Actually, we plagiarized these ideas from our friends in Michigan and Colorado.
That's good.
But so many people these days drink bottled water, which I've got a bottle up there right now, instead of drinking fluoridated tap water. And most bottled water does not have any fluoridation in it. I even sneaked some out of one place here in Arkansas and had it tested, and it had no fluoride in it.
Is that right?
So the drinking fluoridated water is the most efficient way to avoid dental disease, especially for people in rural populations or socioeconomically depressed that don't have access or the money to get to a dentist right now. So they can have preventative measures.
And so the tap water can, in many cases, be better for you than actually bottled water.
Yes. In fact, we just finished with the Office of Oral Health and Arkansas Children's Hospital. We help fund we call it the BSS, Basic Screening Survey, and that is a national standardized scientific survey that's done every 5 years. And this last year we did, actually it's 2016 when the data was collected, and it was published in 2017. And it showed that the people that drank fluoridated water had less cavities. The ones that had well water were slightly worse, and the ones that drank bottled water had the worst of all.
Is that right?
So we've got scientific statistical data in Arkansas now that shows that.
Yeah, it's interesting because you pay for it, but you pay a whole lot less for it. So.
Well, there was a research study done, I think, about a year or two ago in Texas for Medicaid, and it said that every dollar spent in fluoridating water supplies saved $24 per Medicaid beneficiary per year.
My goodness.
So that's quite a savings to the government that has to cover some of that cost.
Yeah, heck yeah. That's remarkable. Now, if you have tap water, does that guarantee you that you have fluoridated water?
No. There's many. First of all, when the Center for Disease Control and Prevention analyzes these statistics, They gather all the different information from states, and the states have to volunteer the information. But I can go on to like Craighead County, and it'll show me a list of every community water system in Craighead County. And so some of them can be as small as 15 customers. So you can have a subdivision that has its own little water treatment system. And so the way we could make the most impact the quickest was to do cities at 5,000 or over. So that's been our biggest project, and we're almost through with that. I see the light at the end of the tunnel.
That's fabulous. That's but you've said Jonesboro for our local viewers. Jonesboro has had this program for a while.
For over 50 years.
50 years.
I think it was in Cincinnati 2 years ago that Jonesboro received an award for its 50th year being fluoridated.
Very nice. That's good to know. So I drink my tap water and be happy.
Yes. Well, just drinking water is good for you, but if it's fluoridated, it's even better for you.
Well,
yes.
What about, should we filter? You know, they have all these filters that on machines and that's being sold to us. Is that critical?
It depends on the individual water. I've seen water that's had a little bit of particulate matter in it, but it's minuscule. Some of them have different minerals in them. I think like in central Arkansas, they have a little manganese in the water. I don't think it hurts you at all, but it may leave a ring around your commode. But there's no regular filtering system like you can put on a house that would filter out fluoride. I think you have to use a reverse osmosis system to do that. So in some locations, you know, fluoride's naturally occurring. And so it's in nearly all the waterways, just in different amounts. And sometimes it even varies by rainfall and the time of the year. But in areas in Colorado, I think some in northern Texas, I think there's even some in Arkansas where they have higher fluoride content in the water naturally than what's prescribed by the Center for Disease Control. And if it's too high, then they have to remove it, the excess. So there's an optimal amount. I compare it to people say, oh, well, even if it's only 0.7 of a part per million, which that's not very much, you know, it's like taking aspirin. You know, taking 1 or 2 aspirin might be good for you if you got a headache, but yeah.
you
don't want to take a couple thousand.
Right.
So.
Right. Very good advice. Now, what else do we need to discuss? Is there anything else that you guys are doing that's worth?
Like I say, we're trying to work with the medical groups, and shortly the corporate side. Of course, I work on the foundation side, but our corporate side will be helping the Office of Oral Health try to train medical centers to institute an oral health component. We gave the University of Arkansas Med Center grant a year and a half ago, and they're developing an oral health curriculum to put in every student that has to go through the program, whether they're a pharmacist, a nurse practitioner, a physician's assistant, MD. They will all have to take this course in oral health to graduate. And then the best thing I think about it is, I'm thinking about like ASU, and you know, they got a great nursing school up here to train all these new nurses so they don't have to do it years later. And after UAMS develops this program, they're going to push it out to all the other institutions in the state free of charge. So they'll develop one, and Dr. Gardner down there, her goal was to make this the best course in the nation.
Yeah.
So that's a high goal. If she gets there, I'll be really pleased. And if they can do that at Fayetteville and at Southern Arkansas and ASU, it'll make a big difference. Might be 4 or 5 years, but it'll be worth it. So that's something that's down the line, but it's starting to happen right now. Just be a while before we see results from it.
Very nice. Well, have you scheduled another Our Mom Day of Caring in the future?
The next one is in Springdale. I don't have the exact date. It's usually like the last weekend in April, the first weekend in May. Okay. And been to Springdale. This will be the 3rd time that I know of that we've been to Springdale. And it's surprising when I got into this job and really started researching it. You think of Jonesboro, northwest Arkansas being pretty affluent compared to the rest of the state, and then of course Little Rock. But all of a sudden in my research I found out there's a lot of people in these communities that need help.
Yeah.
So that was kind of a surprise when I was thinking, well, we'd go down to Texarkana and the lower part of Arkansas where we're generally more rural. We have a lot more minorities down there, and the whole area can be economically depressed. And then you look at northwest Arkansas and say, oh boy, look, that's a vibrant place with all these big businesses. It's amazing how many children, especially first generation immigrant families, the Marshallese population that are big in Springdale, northwest Arkansas,
Right.
how much need there is there.
Is that right?
So it's not just access or money, but it's also cultural differences.
Right.
But the biggest indicator that I've seen so far is socioeconomics.
Yeah. That makes sense. It really does. Well, thank you so much for coming to visit with us on Let's Talk Jonesboro. I know you have things to do with the mayor and this afternoon, so I thank
Yeah.
you for visiting with us.
Yeah, the mayor wants to find some outdoor watering stations with fluoridated water in them.
Fluoridated water in our
Yeah.
outdoor watering stations.
Yeah,
That's a good plan.
a new program for us. Like I say, we've tried to borrow some information from our friends in other states, and they're having success with it. The first year, ACI in Little Rock and Healthy Active Arkansas helped screen 120 schools, and then I think that's how many they had, and then 20 of them got grants to put bottle stations in, and so they actually got a new water fountain, and you can put your own bottle in, and so the schools you had to have a policy that allowed the students to carry their own water bottles, but it's even got a counter on it that tells you how many bottles have been, plastic bottles that go in landfills and live for another 1,000,000 years, how many bottles have been saved.
Very nice.
So it helps the students, helps the environment.
Well, he's Weldon Johnson with the Delta Dental Foundation out of Little Rock, and every time he comes to Jonesboro, something good happens for Jonesboro. So
I always enjoy the visit too.
well, we enjoy it too.
Jonesboro's a neat place to visit. Got lots of good places to eat. I always enjoy the trip.
Very good. Well, thank you for visiting with us.
Thank you. I appreciate it.
Yes, sir.